Students, welcome back. Now we are going to see the dynamic stabilization of the glenohumeral joint, part 2. In that, the rotator cuff, which involves in glenohumeral stabilization. The rotator cuff muscles are the supraspinatus, infraspinatus, teres minor and the subscapularis. So this is commonly referred as an acronym called SITS, S-I-T-S, SITS, isn't it? So the first one is the supraspinatus, which is attached to the upper impression on the greater tubercle, and then infraspinatus in the middle impression, and next one is the teres minor, which is at the lower impression on the greater tubercle, whereas this subscapularis, which is present on the anterior aspect, which is inserted on the lesser tubercle. Okay, so here they have given the action lines of all these 4 segments of the rotator cuff. This is the supraspinatus action line, and then the infraspinatus from the middle impression, and from the lower impression the teres minor, whereas the subscapularis and the anterior aspect, which is present in between these 2 action lines, so that is present in the dotted lines. So if you can see all these things, so the supraspinatus only acting superiorly, the action line is present superiorly, whereas the remaining 3 are more or less equal in the equal in the way, and these are referred as cuff because all the fibers are blend together. So the supraspinatus from subscapularis to the teres minor, all the fibers are blend together, forming a cuff on the superior aspect of the glenohumeral joint, and gives joint stability superiorly. Okay, here, because of all these 3 muscles, that is infraspinatus, subscapularis and the teres minor, more or less equal in the same action lines with a slight difference. So all these 3 as taken as a single force component, so that is called FITS. So the resultant force of all these forces is mentioned here, that is the resultant force vector of ITS, not supraspinatus. So here, if you resolve this force into 2 components, one is the rotatory component as well as the translatory component, rotatory component and the translatory component. Here the translatory component, that is Fx, which is acting inferiorly, along the shaft of the force, that is along the parallel axis or long axis of the shaft of the humerus, whereas the rotatory component is acting towards the joint. So if you see these 2 forces also, here the rotatory component is somewhat larger than the translatory component. So the resultant force ITS causes somewhat greater rotatory force than the inferiorly acting translatory force. Okay, so what will happen, how these forces are working on this glenohumeral joint now? So the perpendicular component, the perpendicular force component Fi, so the name itself indicates that it causes some rotation. It is a rotatory component. Because of this articular surfaces, because of the articular surface. This is the convex articular surface. So because of this force, this rotatory force causes some rotation of the humeral head, and it is also perpendicular to the long axis of the bone. So this force is also perpendicular to the long axis of the bone. So that means this force is acting towards the glenoid fossa. The force is acting towards the glenoid fossa. So this is due to the fact that the articular surface of the humerus lies nearly perpendicular to the shaft of the humerus. So this is happening due to the articular surface is perpendicular to the shaft of the humerus, which shows that this force, this Fy, this perpendicular force, not only causes rotation but also causes joint compression. It also causes joint compression. Okay? So around a joint axis. Okay? So this force clearly illustrates that the rotatory component may do more than rotate a bone around a joint axis. That means this rotatory component not only causes the rotation of the humerus, but it also compresses the humeral head on the glenoid cavity. Okay, glenoid fossa. So that means because of that compression of these forces, these rotator cuff muscles, that is infraspinatus, subscapularis and teres minor, will stabilize the head during rotation, during motion of the glenohumeral joint. All these forces causes some compressive effect. That means it will make the articular surface contact, that especially the center of the head is always kept in contact because of these forces, this perpendicular forces created by the ITS. Okay, so it will not allow any other translations. Okay, now, so this causes what is happening to the glenohumeral joint here. Is it helping in rotation, as well as it is giving some stabilization. It is giving stabilization to the head of the humerus on the glenoid fossa during movement. Okay, next. So what is the function of this force, this translatory force Fx? So all the three Fx's, that is the translatory pull, this is the inferior translatory pull of all these three muscles, will balance the force which is creating by the translatory force of the deltoid. So in the deltoid muscle we have seen that there is a larger translatory motion superiorly. Because of this larger translatory motion and lesser rotatory component, so there may be a superior gliding of the head of the humerus, and it may impinge the structures between the coracoacromial arch and the head of the humerus. Okay, so this force has to be balanced, not to impinge that. So the gravity is not enough to balance this. This requires other muscle forces. Now here the other muscle forces are nothing but the rotator cuff muscles. We have explained, we have mentioned earlier in the session. So now that translatory pull, that is the negative translatory pull of all this ITS, will balance this translatory component of the deltoid. Now this force is balanced by this force, and the ITS forces, that is the perpendicular forces, helps in what? Stabilization, as well as, and also causes some rotation, least rotation. It causes least rotation of the head of the humerus on the glenoid fossa. Got it? So stabilization part is over here. So this force is balanced by this force. Then what is that? So the rotatory component, that is Fx, is present of the deltoid. Then the action of this deltoid is come into action. So this force helps in the abduction of the arm. So this is, and these forces, these perpendicular forces also causes some least rotation, which helps in the increase of the momentum of the deltoid. Now we have seen the function of this ITS. Now coming to the supraspinatus. So before going to supraspinatus, the another important thing regarding this ITS. So what is the main function caused here by this ITS? The FX component, that is the parallel component, is balancing the upward translatory force of the deltoid. So these forces are balanced. Now the forces of ITS, which helps in the stabilization during the movement of abduction, isn't it? That means it is controlling not to translate anteriorly and posteriorly. So the subscapularis, which is present on the anterior aspect, will control not to translate anteriorly, and the muscles which are present on the posterior aspect, that is the infraspinatus and teres minor, will helps to not to translate posteriorly. That means it is maintaining the head of the center of the humerus in contact, so not to slide anteriorly and posteriorly. So these muscles are called as steerers. It is acting as a steering in a car. So these muscles are called as steerers. Okay. And also another important thing is, here you have to observe this, the teres minor and infraspinatus muscle, in addition to the teres minor and the infraspinatus muscle, in addition to the stabilizing role, it also contribute to abduction of the arm. So not only stabilizing the joint, it also helps in the abduction of the arm by providing lateral rotation, which occurs with the elevation of the humerus to clear the greater tubercle from beneath the acromion, which is from beneath the acromion process. Okay. So the teres minor and infraspinatus not only helps in the humeral stabilization, but it also helps in the abduction by providing the lateral rotation, which normally occurs in the elevation of the humerus to help to clear the greater tubercle from beneath the acromion process. Okay, this is the other function of this, the two muscles of the rotator cuff. Although the teres minor is having a weak adduction force, teres minor will have a weak adduction force, and the medial rotatory force of the subscapularis also appear. But during the elevation of the arm, the forces which are created by the infraspinatus and teres minor is more than that of the subscapularis muscle. So these forces overcome the force of the subscapularis. The subscapularis acts as a medial rotator. So these two muscle forces overcome the subscapularis. So the subscapularis function is diminished in the case of elevation of the arm. Okay. Now, how it happens means the infraspinatus and subscapularis muscles add to the abduction. The infraspinatus and the subscapularis muscle acts in abduction, whereas the teres minor muscle adds to lateral rotatory torque. So all these muscles will contribute in the abduction. Okay, the infraspinatus and subscapularis muscles add to abduction, whereas the teres minor adds to the lateral rotatory torque. Okay, the medial and lateral rotatory forces also help. The medial and lateral rotatory force also help to center the humeral head in an anterior and posterior direction. In an anterior and posterior direction. Okay, so because of all these functions, that means whatever this action of all these muscles is maintaining, although it helps in abduction movement also, but also it is providing stabilization, not to translate anteriorly and posteriorly and maintain the center of the humerus in contact. Okay, so now the action of the deltoid and the combined actions of the infraspinatus, teres minor and the subscapularis forms a force couple. Okay, so this force couple helps in the perfect rotation of the humeral head around a relatively stable axis of rotation with minimal translations. That means here almost all we will get a pure rotation of the humeral head on the stable axis. So there is, and with minimal translations, that means during rotation it will not move forward and backward, and it is perfectly, the rotation is maintained because of this rotator cuff muscle action along with deltoid. Okay, so finally these rotator cuff muscles, that is ITS, is referred as steerers. Okay, so if these muscle actions are not, if any injury to this rotator cuff muscles, any this ITS leads to instability of the glenohumeral joint during elevation of the arm. That means we can see the translations, anterior and posterior translations of the humeral head during motion. Okay. Now coming to the supraspinatus, how the supraspinatus helps in the glenohumeral stabilization. So this is the only force which is acting superiorly. Okay. So this supraspinatus muscle is a part of the rotator cuff. The line of action of the supraspinatus muscle has a superior translatory force. So the remaining three will have the inferior translatory force, but so this is the action line of the supraspinatus. If we resolve the forces, so this is the perpendicular component and this is the parallel component. This is having a superior translatory component rather than the inferior component found in other muscles of the rotator cuff. Given its line of pull, the supraspinatus is not able to offset the upward dislocating action of the deltoid. Okay. The supraspinatus muscle itself acts as an effective stabilizer to the glenohumeral joint. However, because of the more superior position or superior location of the supraspinatus, results in a line of action that lies further from the glenohumeral joint axis. So here it is the glenohumeral joint axis is present here. Because of the superior location, the line of action is farther from the glenohumeral joint axis than the action lines of other rotator cuff muscles. Okay. So this one is far away from the joint axis. Okay. So the action lines of the other rotator cuff muscles, when we compare with the other action lines of the rotator cuff muscles, the supraspinatus will have large momentum. So when you compare here, so this is having large momentum than that of the remaining rotator cuff muscles, and it is capable of, so this large momentum of the supraspinatus is capable of independently producing full or nearly full range of glenohumeral joint abduction, and also simultaneously it is giving stabilization of the joint. So if you see here, for this, gravity acts as a stabilizing synergist to the supraspinatus by offsetting the small upward translatory pull of the muscle. That means, so here there is an upward translatory pull, isn't it? So this force is balanced by the gravitational pull. So this translatory force and this gravitational force is going to be balanced here, and only this rotator component is free now, and this rotatory component helps in the movement of the glenohumeral joint. That means it helps in the abduction. So the supraspinatus muscle itself acts as an abductor of the shoulder without any other muscles are involving. That means only supraspinatus is having the capacity to produce abduction because of these translatory forces or balanced by the gravitational force here. But that is not happened in the deltoid, and this supraspinatus action, this momentum is added to the deltoid momentum by stabilizing the translatory component with that of the inferior translatory pulse of the ITS, which finally increasing the full range of motion. Okay, this is happening in the uh, dynamic stabilization of the glenohumeral joint. So all these components are balanced, and ITS, how it is supporting the joint, giving stabilization. Although it is involving in the movement, it also gives the stabilization. The supraspinatus also, it also helps in the stabilization because of its uh, location itself, is it is giving some stabilization, and also this action line which is towards the joint also compresses the humeral head to the glenoid fossa and also causes rotation, which helps in the abduction of the glenohumeral joint. Okay, this is about the rotator cuff contribution in the glenohumeral dynamic stabilization. In the next uh, session, in the next video, we are going to see the long head of biceps involvement in the glenohumeral dynamic stabilization. Thank you.